welcome to In Depth. I'm Teena Jha. In the year 2017, the NITI Aayog, in collaboration with the World Bank and the Ministry of Health and Family Welfare, started work to develop the first comprehensive state health index in India. Taking into account various health parameters, the first edition of Healthy States Progressive India report on the ranks of states and union territories was released in February 2018. It was the first attempt to establish an annual systematic tool to measure the heterogeneity of the nation's performance in the health sector. The second edition, released on 25th of June this year, focuses on measuring the overall performance and incremental improvement over a two-year period, 2016-17 and 2017-18, in all states and union territories. This index is a composite score incorporating 23 indicators. And for the second time in a row, Kerala has emerged as the top-ranking state in overall health performance, while Uttar Pradesh has been the worst-performing state. Today in Depth, we talk in greater detail about the second health index, its key findings and results, and the way ahead in bringing about positive transformation in the health sector of the country. As per the second health index, the overall health index score of the best performing state is more than 2.5 times of the overall score of the least performing state. Kerala championed the larger states with an overall score of 74.01, while Uttar Pradesh was the least performing state with an overall score of 28.61. Several states have also made good progress towards achieving SDG goals included in the index. Kerala and Tamil Nadu have already reached the 2030 SDG target for NMR, which is 12 neonatal deaths per 1,000 live births. Maharashtra and Punjab are also close to achieving this target. The NITI Aayog on 25th of June released the second edition of its comprehensive health index report titled Healthy States Progressive India. The report ranks states and union territories innovatively on their year-on-year incremental change in health outcomes and also their overall performance with respect to each other. According to the report, states and union territories have been ranked in three categories: larger states, smaller states, and union territories, to ensure comparison among similar entities. Among the larger states, Kerala, Andhra Pradesh and Maharashtra are ranked on top in overall performance. Gujarat, Punjab and Himachal Pradesh are 4th, 5th and 6th respectively. Uttar Pradesh, Bihar and Odisha were among the worst performing states. In terms of annual incremental performance, Haryana, Rajasthan and Jharkhand are the top three states. They also show the maximum gains in improvement of health outcomes from base to reference year in indicators like neonatal mortality rate, under 5 mortality rate, proportion low birth weight among newborns, proportion of districts with functional cardiac care units, proportion of ANCs registered within the first trimester, full immunization coverage, institutional deliveries, etc.
हमारे तो बड़े ट्रांसपेरेंट क्राइटेरियाज हैं सब चीज़ों और ट्रांसपेरेंट क्राइटेरिया फील्ड से हम लोग एसेस करते हैं और अगर हम इंक्रीमेंटल रैंकिंग देखते हैं तो इंक्रीमेंटल रैंकिंग के बेसिस पे हरियाणा नंबर 1 पे है, राजस्थान नंबर 2 पे है, झारखंड नंबर 3 पे है, आंध्रा नंबर 4 पे है और झारखंड और असम नंबर 5 पे है. तो बेस्ट परफॉर्मेंसेस इन 5 स्टेट्स की हैं.
Among smaller states, Mizoram ranked first, followed by Manipur on overall performance, while Tripura followed by Manipur were the top-ranked states in terms of annual incremental performance. Manipur registered maximum incremental progress on indicators such as full immunization coverage, institutional deliveries, and total case notification rate of tuberculosis. Sikkim and Arunachal Pradesh had the biggest decrease in overall health index scores among smaller states. Among the union territories, Chandigarh, followed by Dadra and Nagar Haveli, occupied the top two positions in terms of overall performance as well as annual incremental performance.
So, health index is an attempt by NITI Aayog to bring the focus on outcomes. If you look at the general way that the government functions, we were looking at mostly financial, what is the budget, how much of the budget has been spent, and then also some kinds of physical infrastructure. So, have we created X number of clinics, PHCs, district hospitals, community health centers, then also how many people have been employed, but what is the benefit which is accruing to the citizens, that was not measured as much. So, what we have done is, so how do you define the outcomes of a health system? So, if a health system is good, you would expect mortality to be low, fertility to be low, and the processes through which these are achieved.
NITI Aayog health index is basically, it's a comparison of health indicators. There are 23 health indicators which they have compared with the previous years, like 15-16 they have compared it with the 17-18. So, there is a 23 health indicators, and the comparison, in comparison they say that whether any state, like they have divided states into three categories, large state according to population, large state, small state, and the UTs, and they have compared all this large, small and UTs with each other, and then they have decided whether the states have performed better.
According to the report, the decline in the overall health index score of 5 empowered action group states, Bihar, Uttar Pradesh, Uttarakhand, Madhya Pradesh and Odisha, between the base year and the reference year is attributed to the deterioration of performances of several indicators. The report points out that there was a general positive correlation between the health index scores and the economic development levels of states and union territories as measured by per capita net state domestic product. The report also notes that overall there is room for improvement in all states, even among the best. It says that even among the large states, the overall health index score of the best performing state is more than 2.5 times of the overall score of the least performing state. Further, the report says that many states have made good progress towards achieving sustainable development goals included in the index. Bureau Report, Rajya Sabha TV. Multiple stakeholders contributed to the health index. The NITI Aayog provided overall stewardship in collaboration with the Ministry of Health and Family Welfare, while the World Bank provided technical assistance. States and union territories, national as well as international experts also contributed towards the completion of the health index exercise. Here's a detailed report on the methodology used by the NITI Aayog.
The NITI Aayog launched the Health Index to measure the performance of states and union territories in the sector. NITI Aayog hopes that the index will promote a cooperative and competitive spirit among the states and union territories and help bring about transformative action in achieving desired health outcomes. The Health Index will be an annual systematic tool to propel states towards undertaking multi-pronged interventions that will bring better health outcomes. The second round of the Health Index, referred to as Health Index 2018, examined the overall performance and incremental improvement in states and union territories for the period 2015-16, which is the base year, to 2017-18, the reference year. The indicators, methodology and categorization of states and union territories in the Health Index 2018 were broadly consistent with the 2017 round, with a total of 23 indicators grouped into the domains of health outcomes, governance and information, and key inputs and processes. With the use of an interactive web portal, states and union territories submitted data on identified indicators. Subsequently, the data was verified by an independent validation agency prior to computing the index, and ranks were awarded to the states and UTs. Just like the 2017 round, the states were grouped in three categories to ensure comparison among similar entities: larger states, smaller states, and union territories.
2 years, one is called as a base year and we take a reference year. So, within how much movement has the state made between base year and reference year. So, if you see, there are some states which are far ahead and have better health systems for the simple reason that they have prioritized that sector for a long period of time. So, if we compare states which have done so for number of years, then what is likely to affect is that the states which are at lower levels of progress may feel disheartened or discouraged. So, what we have done is we rank the states in two ways. One is on the overall or historical performance, and second is on incremental performance. So, even if you are low down the order, you have greater scope for improvement. So, if you are able to move between these 2 years, then you get more credit for it. So, if you see the report, you will have two rankings. One is the overall ranking and one is the incremental ranking on the incremental performance.
After validation of the data by the independent validation agency, the data submitted by the states and pre-filled from established sources were used for the health index score calculations. Each indicator value was scaled based on the nature of the indicator. For positive indicators, the higher the value, better the performance. And for negative indicators, the lower the value, better the performance. The minimum and maximum values of each indicator were ascertained based on the values for that indicator across states within the grouping of states for that year. The scaled value for each indicator lies between the range of 0 to 100.
There are many indicators, like if you see the birth weight of the child at the time of birth, what is the birth weight? Then we have to see the sex ratio. What is the sex ratio at the time of birth? Then we have to also see like if the healthcare facilities were accredited or not, means NABH accreditation are available or not. Then they have also see whether infectious disease were controlled as per the government norms, like the tuberculosis is getting treated as per the government norms or not. And they also see that whether the money, like the funds which was given by central government to the National Health Mission, whether that funds were getting transferred to the people or not, whether that schemes were implemented or not. So, this type there are many parameters on which they have compared and formed this index.
The ranking was primarily based on the incremental progress made by the states and union territories from the base year to the reference year. However, rankings based on index scores for the base year and the reference year have also been presented to provide the overall performance of the states and union territories. A comparison of the change in ranks between the base and reference years has also been undertaken. The NITI Aayog completed the Health Index 2018 with certain amount of limitation. Some critical areas such as infectious diseases, non-communicable diseases, mental health, governance and financial risk protection could not be fully captured in the index due to non-availability of acceptable quality data on an annual basis. With inputs from Vipul Agarwal, Bureau Report, Rajya Sabha TV.
And time for a short break on the program. When we return, we'll talk about the steps being undertaken by the Modi government to transform the health sector in the country. Do stay with us. Welcome back. You're watching In Depth. India's healthcare industry is one of the fastest growing sectors and is expected to reach 280 billion by 2020. The Indian healthcare sector is much diversified and is full of opportunities in every segment that includes providers, payers, as well as medical technology. In our next report, we get you the various initiatives being undertaken by the Modi government to strengthen the healthcare sector in the country.
India's healthcare sector is growing at a brisk pace due to its coverage, services and increasing expenditure by public as well as private players. The healthcare delivery system is categorized into two major components, public and private. The public healthcare system is made of secondary and tertiary care institutions in key cities and provides basic healthcare facilities in the form of primary healthcare centers in rural areas. The private sector provides majority of secondary, tertiary and quaternary care institutions with a major concentration in metros, Tier 1 and Tier 2 cities.
As you know, in the health sector, we have a group of states identified as the EAG states, Empowered Action Group states, where health indicators are not as good and we want to focus. So, part of the NHM funds is based on backwardness, which means that you give more money to the states which are more backward or relatively poorer, faring poorer in terms of health indicators. But then if you give them more money and they are not able to utilize it, that is also not a. So, we also now have decided that a part of the NHM funds will be allocated based on the performance on this indicator. So, that would mean that a part of the fund will be available in terms of for equity concerns, that because every citizen of India should have similar health facilities wherever he or she resides.
Some of the major initiatives taken by the government to promote the Indian healthcare industry include a reduction in mortality rates for women and children. With sustained momentum, these have seen a faster rate of decline in the last few years. India is on course to attain Sustainable Development Goal targets for maternal and child health, much ahead of the agreed date of 2030. In 2014, the centre launched the Pradhan Mantri Suraksha Matritva Abhiyan, as part of which doctors pledge a day of service per month to the campaign and 16 million antenatal care checkups were performed. On September 23, 2018, the government launched the Pradhan Mantri Jan Arogya Yojana, a cashless health insurance cover of up to 5 lakh rupees per family per year, covering 500 million poor citizens. In August 2018, the government approved Ayushman Bharat National Health Protection Mission, contributed by both the centre and the state government at a ratio of 60-40 for all states, 90-10 for hilly northeastern states and 60-40 for union territories with legislature. It provides healthcare facilities to over 10 crore urban and rural poor families. The mission Indradhanush covers immunization. Under this, the government reached 32.8 million children and 8.4 million pregnant women in the last 3 years. The number of vaccines has been increased from 7 to 12. To address malnutrition among children, the government launched Poshan Abhiyan and is also implementing Rashtriya Bal Swasthya Karyakram that has provided 800 million health checkups and free referral treatment to 20 million children in the last 4 years. The Pradhan Mantri Matru Vandana Yojana is expected to benefit 50 million pregnant women and lactating mothers. The scheme enables direct benefit transfer to their bank accounts to compensate for wage loss, enable better nutrition and adequate rest before and after delivery.
Two things. One, that it focuses every state on outcomes, which really is what impacts the citizens. Two, it is also a tool for assessing our readiness on achieving the SDG goals. So, these are the two main things. And three, we are also setting up incentives for states that if you perform well on your health system measurements, then you will also get more money.
The India's healthcare industry is expected to reach $280 billion by 2020. India is also one of the leading destinations for high-end diagnostic services with tremendous capital investment for advanced diagnostic facilities. Bureau Report, Rajya Sabha TV.
India has seen improvements in healthcare access and quality since 1990. According to Global Burden of Disease study released by Lancet, one of the world's oldest and best-known general medical journal, India ranked 145th in 2016 from 153 in 1990 among 195 countries in terms of quality and accessibility of healthcare. Though India's improvements on HAQ index has hastened, but the country lags behind its neighbors like China, Sri Lanka and Bangladesh, among others.
When it comes to world rankings, India was 145th among 195 countries on Healthcare Access and Quality Index in 2016. The comprehensive index released by Global Burden of Disease, funded by the Bill and Melinda Gates Foundation, says that despite such low rankings, India has seen improvements in healthcare access and quality since 1990. According to the study done by researchers from 127 countries in 2016, India's healthcare access and quality scored 41.2, up from 24.7 in 1990. Despite the 16.5-point improvement in 26 years, India's score is well below the global average of 54.4. Despite improvements in healthcare access and quality, India lags behind its BRICS peers, Brazil, Russia, China and South Africa on the HAQ index. It, however, matches China in the disparity in healthcare access and quality between states. The index is based on 32 causes of death considered preventable with effective medical care. It assigns a 0 to 100 score to each of the 195 countries and territories assessed. Within India, the best performers, Goa and Kerala, scored more than 60 points on the HAQ index in 2016. Other top performers are Delhi at 56.2, Himachal Pradesh at 51.7 and the Union Territories other than Delhi. The worst performers were Chhattisgarh and Jharkhand, Bihar, Odisha, Uttar Pradesh and Assam. This gap between the highest and lowest scores increased from a 23.4-point difference in 1990 to a 30.8-point difference in 2016. The study said these regional differences in India could be due to multiple reasons such as large variations in physical access to health facilities, the state of health infrastructure, the level and scale-up of medical technologies and the provision of effective services across the spectrum of care. According to the index, India ranks worse than Bangladesh, Sri Lanka and Bhutan among its neighbors, but better than Pakistan, Afghanistan and Nepal. In South Asia, Bangladesh made the most improvement of 29 points, improving its ranking from 180 in 1990 to 132 in 2016. In contrast, the rankings of Afghanistan and Pakistan worsened from 187 to 191 and 145 to 154 respectively. India's rank is also worse than that of many poorer countries in sub-Saharan Africa such as Sudan, Equatorial Guinea, Botswana and Namibia. The 5 countries with the highest levels of healthcare access and quality in 2016 were Iceland, Norway, the Netherlands, Luxembourg and Finland and Australia. The study found that high to middle income countries recorded higher scores and made greater gains in countering non-communicable diseases. Most other countries also made improvement in key health areas, most notably vaccine-preventable diseases. The study found generally countries that spent more on health per capita and had better health systems scored higher on the HAQ index. According to a report by the journal India spends just 1.4% of its GDP on health. The World Health Organization recommends that countries spend 4 to 5% of their GDP on health to achieve universal health care. Bureau Report, Rajya Sabha TV.
And that's it from us in this edition of In Depth. We'll be back same time tomorrow with a comprehensive view on some other subject. You can also watch our program online on YouTube and Twitter. And don't forget to send your feedback and suggestions about our program. Thank you for your time.